We're back now with a health alert. Cancer is occurring in more adults at younger ages before they turn 40 or 50, and sometimes even earlier than that.
Very concerning. These are called early onset cancers, and one recent study questioned if this is an emerging epidemic. Joining us now to talk more about these cancers is Dr. Veda Giri, director of the Early Onset Cancer Program at Yale Cancer Center. Doctor, thank you so much for joining us. We've reported before about rising rates of colon cancer among younger people, but are you also seeing a rise in other cancers with this younger population?
Yes, thank you so much for having me, Amber and Kevin. It's great to be here. And this is such an important topic and a very important question. We're actually noticing increases in cancers across the cancer spectrum, not only for colorectal cancer, but also for cancers such as breast cancer, thyroid cancer, kidney cancer, prostate cancer. We're really seeing it across the cancer spectrum.
And doctor, lifestyle factors such as diet, environment, they often are cited as influencing cancer risk, right? So are these factors contributing to early onset cancer, or is something else?
This is really the key question we get asked all the time by patients and families is why is this happening? And some of these factors that you raise are really critical to explore. Is it diet and lifestyle factors? We do notice that there have been some generational changes in these rates of rise of early onset cancers. So it's really important to explore things such as lifestyle, diet, exposures, environment, and also looking at family history and potentially genetics, all working together to potentially explain this rise in early onset cancers. So more research is needed.
Doctor, moving forward, how should doctors help patients look out for cancer? Should screening guidelines be revised to include younger populations, as we've seen with colorectal cancer?
This is really key in terms of thinking of how we can empower our patients, our healthcare community, and really the community in general about thinking of ways to screen early. One of the key pieces of information that could be really helpful is knowing a person's family history. So if there is a family member that has had, for example, colon cancer diagnosed, for example, father, mother, siblings, that person may be recommended to start cancer screening at a younger age. So family history can be one of the key pieces of information to start screening at a younger age, and also potentially to inform genetic testing, where that information could be helpful to start screening earlier as well. Whether the entire population should or not, I think deserves more study.
Very, very important stuff there, too. Dr. Veda Giri with Yale Cancer, thanks so much for your insight tonight. We greatly appreciate that.
Pleasure to be here.
Thanks, doctor. Still ahead here.